Hi, my name is Dorothy,
I'm Valerie.
and today we're going to be teaching you guys how to inject medication into an IV bag. First, we're going to go wash our hands.
Now that we washed our hands, we're now going to get gloved.
We need to make sure that we use gloves so we can maintain a sterile field because we have a sterile needle. So, once she puts on her gloves, she's going to need to grab an alcohol swab. We need to make sure that we use an alcohol swab to clean off the rubber port. So just as Valerie has already cleaned and disinfected the port, the rubber port, she needs to look at the IV solution and make sure that there are no particles or tears in it. Okay, once she's inspected the IV solution, we can go ahead and grab our sterile needle. So here's our sterile needle. I'm gonna have Valerie pick it up, and once she takes the cap off the needle at the very end, she cannot recap it. And we have our sharps container right here to make sure that once she's finished, that's the correct way to dispose of it. Before we inject the medication into the IV bag, we have to make sure that we know that this right here is called a stopper. If you want to open the stopper, then you push it, and that allows the fluid to come out. If you want to close it, then you push it back this way, and it pinches it. Okay, so I'm gonna have Valerie come on over, and she is going to inject the needle into the rubber port. Be very careful. Do not rush it because you can prick yourself. As Valerie slowly injects the medication into the IV solution, bubbles should rise to the surface.
After I'm done with the needle, I make sure to not recap it and put it in a biohazard sharps container. After I've injected the medicine, I'm going to mix it by pushing my hands into the IV bag. Now that we have thrown the needle away, we're going to throw away our gloves and we're going to go wash our hands. Now that I've demonstrated to you how to work this, we're going to demonstrate it to our RN in training, Mallory.
Hi, I'm Mallory.
She's going to first wash her hands. After she's completed washing her hands, she's now going to get gloves on. We also have our sterile needle and our alcohol swabs from before. As soon as she gets her gloves on, she's going to start with the alcohol swab and swab the rubber port.
Okay, so now that I've cleaned the rubber port with alcohol, I'm going to check the IV bag for tears or holes and leaks. Now that the bag has no tears, I'm going to uncap my needle and I'm going to go over to the IV bag. And I'm going to be very careful that I inject the needle into the rubber. And now I'm going to slowly inject the medication, watching for bubbles. Now I'm going to take my needle and put it into the sharps container. Now that I've successfully injected the medication into the IV bag, I'm going to mix the medication by doing this motion on the IV bag. And now I'm finished. I'm going to take my gloves off. I'm going to throw them in the trash can. And I'm going to wash my hands.